Hello everyone. So you guys diagnosed it very well. It was a case of primary hyperparathyroidism. So it was a 32-year-old male who presented to us with pathological fractures of bilateral femur along with history of renal stones with constipation and abdominal pain. And there is history of such type of pathological fractures in the past. And with these findings, along with the lab values of increase in calcium and decrease in phosphate levels, there is something in the body that is causing the calcium to get absorbed from the bones and release in the bloodstream. So this is the function of a parathyroid hormone. So that is why we can reach to the diagnosis of hyperparathyroidism. So how we differentiate between primary, secondary or tertiary hyperparathyroidism? It's like when the disease is in parathyroid gland itself, it is primary hyperparathyroidism. When there is increase in parathyroid hormone due to decrease in calcium levels of the body, that is due to the renal failure. When there is decreased calcium in the body, then that leads to reflux increase in parathyroid hormone, that leads to development of secondary hyperparathyroidism. And when that state stays for a long time, this leads to autonomous function of parathyroid gland, that leads to tertiary hyperparathyroidism. So what are the clinical findings we get in cases of hyperparathyroidism? It is due to the increase in level of calcium in the body. This leads to characteristic findings of bone, stone, psychiatric overtone, and abdominal groans. In the bone, we get pathological fractures. In the stone, we get renal stones, nephrocalcinosis, nephrolithiasis. In the abdominal groans, we get a history of abdominal pain. And psychiatric overtones, we get features of psychiatric disturbances in the patient. There are specific skeletal manifestations of this disease, the salt and pepper skull appearance, and osteitis fibrosa cystica, along with the bone resorption leading to decrease in T score of less than minus 2.5, and history of pathological fractures. And the thing that I discussed about was the height of a patient getting decreased along with the age. It can also occur in this disease in view of healed pathological fractures and bowing of femurs that may lead to decrease in the height of the patient. And to perform the better management, firstly we need to diagnose this condition, and to basically localize where the pathology is, we can do blood test. And in the blood test we can get serum calcium level, INI calcium level, and kidney function test, along with the serum vitamin D3 and phosphate levels. And in the radiological investigation, we can go for USG, neck, or system AB scan to localize is the pathology located to one parathyroid gland or to all the four. That is it a parathyroid adenoma, or is it a parathyroid gland hyperplasia as seen in Men syndrome. And in the management, first of all, we need to decrease the calcium levels in the blood. That can be done by the use of bisphosphonates, glucocorticoids, denosumab, and other drugs like mitramycin and plicamycin. And for the definitive management, we need to